So let's start with the reality that the current U.S. healthcare system is, well, stretched to its breaking point. Across the board, there are too few primary care providers, especially as demand climbs with an aging population and growing rates of chronic diseases. And to make matters worse, a lot of the people actually delivering care are working in these fragmented systems where burnout is just, almost inevitable.
Yeah, I've heard about burnout a lot lately. It's like every conversation about healthcare workers ends up circling back to it.
Exactly. And we're not just talking about physicians here either. It's everyone: nurses, medical assistants, anyone on the front line of care. The system is so disjointed that too often people feel like they're running on a hamster wheel, reacting to crises rather than actually addressing the bigger picture.
Okay, so if the system's broken, then let's get to how it can actually be fixed. Where does this IPCI you mentioned fit into all of this?
The Interprofessional Primary Care Institute, or IPCI, was created to tackle these exact challenges head-on. At its core, the focus is on team-based, community-oriented care. It brings healthcare providers together, physicians, nurses, specialists, even community health workers, and organizes them into collaborative teams. This isn't just about having more coordination, though. It's about promoting relational care and stepping away from the fragmented, every provider for themselves kind of setup that dominates today.
Team-based care? I like the sound of that. I mean, it kind of makes sense, right? Most industries have shifted to teams in some capacity to improve workflow. Why not healthcare?
Exactly, David. And what IPCI does differently is it doesn't stop at healthcare professionals. These teams actively work with social services, schools, community organizations, essentially anyone who touches health in a broader sense. The goal is to make care proactive rather than reactive. Instead of just treating disease, the focus is on addressing the social determinants that contribute to health, like housing, nutrition, education, to create systems of wellness within communities.
Wait, so you're talking about embedding these healthcare teams within communities? Oh, I forgot. Our disclaimer. This podcast is generated by AI and hosted by AI clones, all with creation, guidance, and editing by Dr. Chad Swanson, a full-time ER physician with a passion for transformational change in our health system. Dr. Swanson considers this daily podcast an informal conversation with the world on transformational health systems change. As such, while he edits the AI-generated text and follows up on sources, this should not be considered a definitive source of knowledge. Okay, back to the topic. Like physically putting the health teams in neighborhoods?
That's exactly right. IPCI envisions a model where care happens where people live, where their day-to-day circumstances can be understood and addressed in real time. It's about meeting people where they are and leveraging the strengths of communities themselves to make meaningful changes in health outcomes. By doing this, healthcare becomes something that people experience as a part of their everyday lives, not just when they're sick or in crisis.
All right, this idea of embedding care in communities is compelling. But earlier you mentioned something about relational care. How does that come into play in all of this?
Right? So relational care is essentially about prioritizing human connections in healthcare. It starts with the understanding that both patients and healthcare providers experience better outcomes and overall satisfaction when there's trust, mutual respect, and partnership.
Okay, trust and respect sound great in theory, but how does that play out in a real healthcare setting? Like, how does a provider build that kind of relationship?
That's a great question. It's not about overcomplicating things, honestly. It can be as simple as listening, really listening to patients, taking the time to understand their lives, their values, their goals. It's also about continuity of care. When patients see the same team regularly, relationships develop naturally and care becomes more personalized. Providers can anticipate needs and respond more effectively because they're familiar with the patient's story, not just their symptoms.
So it's like this long-term approach, kind of like knowing your neighbors over time instead of just waving at strangers passing by.
Exactly, David. That's a great way to put it. Studies have consistently shown that patients who have strong, trusting relationships with their doctors are more likely to follow through on treatments, less likely to end up in the ER, and overall report higher satisfaction. And relational care doesn't just benefit patients, it helps prevent burnout for clinicians too.
Oh, I didn't even think about that. How does it reduce burnout?
Well, when providers feel connected to their patients, their colleagues, and even to the broader mission of healthcare, they find more meaning in their work. It's not just about cranking through patient charts, but about being part of something bigger, building partnerships, driving health improvements, making real impacts. That emotional connection can be rejuvenating, like a reminder of why they got into healthcare in the first place.
I can see how that would make a difference. But I imagine there's got to be challenges, right? Like, isn't it hard to build those relationships in a system where time is so limited?
You're absolutely right. Time constraints are a massive challenge. That's where systems like team-based care help. When you have collaborative teams working together, the time burden doesn't fall on one person. It allows providers to work at the top of their skills while still fostering those relational dynamics. It's about shifting the structure of care to support these connections rather than hinder them.
Right? It's like redesigning the workflow to make space for those connections?
Exactly. And it's worth it because those connections are at the core of effective healthcare. If we're going to create a system that serves both practitioners and communities, relational care has to be a central element.
That makes a lot of sense. Redesigning systems to nurture those connections. But it gets me thinking, how do you scale that up? Like moving from fostering relationships in one practice or one community to creating system-wide change. Where do you even start?
Right, David, and that's really where IPCI's philosophy shines. The core belief is that no single person or even profession can overhaul the system on their own. Real transformation, it has to come from collective power and collective action. And IPCI is all about giving healthcare providers and students the training and organizational tools to make that happen.
All right, collective action sounds nice and all, but what does that actually mean in practice? Like, how does it look on the ground?
Great question. A good example is something called team-based care hubs. These are programs set up at major academic medical centers where trainees from nursing, medicine, social work, and pharmacy all learn alongside each other instead of in silos. Then they go out and actually apply those skills together in underserved communities. It's about integrating their training and looking at health challenges holistically as a team.
Wait, so they're not just sitting in a classroom together? They're out there, in actual neighborhoods?
Exactly. It's hands-on, real-world stuff. By working in these communities, these trainees learn to address health inequities head-on, whether it's managing chronic conditions, improving access to medications, or coordinating with social services. They're doing it together. Everyone brings their unique skills to the table, creating solutions that no single professional could accomplish alone.
And you're saying that kind of teamwork can actually change the system?
Absolutely. Think about it. When healthcare providers are trained to collaborate from the start, they stop seeing each other as competitors. It strengthens the fabric of the healthcare system because it's no longer this fragmented collection of individual efforts. Instead, it becomes a cohesive network that can tackle systemic problems.
Huh. So it's like the healthcare version of, I guess, an Avengers team?
You could say that. Though it's less about superpowers and more about, working together effectively to make a difference.
Right. No capes.
No capes, just teamwork, shared accountability, and a commitment to improving care. And it's incredible what can be achieved when we start thinking that way, both as individual providers and as part of a larger system.
So, Sophia, building on all this talk of teamwork and real-world impact, it sounds like communities themselves are central to this transformation. How do they fit in? What does making healthcare more localized actually look like in practice?
That's such a crucial question, David, and it really gets at the heart of IPCI's vision. As much as medicine itself impacts health, we know that the conditions of people's lives, things like housing, education, access to healthy food, play an even bigger role. Localizing healthcare means embedding care in the places where people live so those broader social and environmental factors can actually be addressed.
Okay. But how do you actually implement something like that? Are we talking about clinics popping up at every corner?
Not quite, though that could be part of it. It's more about designing systems that are place-based. For example, you might have mobile clinics or healthcare teams working out of schools, churches, or even shelters, depending on the needs of that specific community. Take the Boston Healthcare for the Homeless program, which I think is a really inspiring example. They provide medical services on site at shelters so people who are housing insecure don't have to navigate the typical barriers of getting care.
Oh, that's smart. So instead of expecting people to come to the care, you bring the care to them?
Exactly. And it's a game changer because it reduces so many obstacles. Think about it. When someone's dealing with housing insecurity, scheduling a doctor's appointment and actually making it to a clinic is, well, it's overwhelming, if not impossible. By meeting people where they are, you ensure they get consistent, reliable care, whether it's managing chronic conditions or addressing acute issues.
Right, right. And I guess it's not just about the care itself, but also about understanding the environment people are living in?
Bingo! Community-based care allows providers to develop a much deeper understanding of the challenges their patients face, things that wouldn't necessarily come up in a sterile clinical setting. That context helps in designing interventions that are actually effective, whether it's connecting someone to housing resources or making sure they have access to healthy meals.
Okay, but does it scale? I mean, sure, it works great in one neighborhood, but what about entire cities or, regions?
It's absolutely scalable, but it takes coordination. The key is creating frameworks that can be adapted to fit the unique needs of different neighborhoods. So, for a rural area, you might rely more on telemedicine or mobile units. For urban settings, it might look like multi-use community spaces that combine healthcare services with other resources. But at the core, it's about centering neighborhoods as the foundation of health systems, from the ground up.
I mean, it makes sense, but it feels like such a big shift from how we usually think about healthcare. Are there any other examples out there?
Sure, a lot of programs are showing us the potential here. Another great model is in community health centers that bring together social services, mental health care, and primary care. By integrating all these elements into one accessible location, they're able to address the whole spectrum of health needs in a way that resonates with the community.
Wow. So healthcare isn't just something that happens to you anymore. It's more like being part of your neighborhood?
Exactly. By rooting care in the community, it shifts the approach entirely. Health becomes something proactive, woven into the fabric of daily life, rather than just being reactive when a crisis hits.
Sophia, tying this all back to what you just described about rooting care in neighborhoods and making health part of daily life. The big question that comes to mind is, how do we make this all stick? What needs to happen to scale these ideas and make them sustainable in the long run?
Great question, David. So, the first thing is embedding interprofessional collaboration into health professions education. If we want future healthcare providers to work seamlessly in teams, they have to learn that way from the start. This means bringing students from different disciplines together, medicine, nursing, social work, and teaching them how to collaborate effectively, not just academically but practically, in real-world settings.
Kind of like planting seeds early so teamwork becomes second nature once they're in the field?
Exactly. And it's not just about teamwork. It's about understanding the strengths and perspectives different professions bring to the table and how to leverage those to improve care. When that mindset is ingrained in education, it not only makes for better healthcare teams, but also creates a foundation for resilience and innovation within the system.
Okay, but education aside, what about the systems that are already in place? I mean, doesn't this need some kind of policy or funding reform to, actually sustain it?
Absolutely. Policy and payment reforms are crucial. Right now, most healthcare systems operate on a fee-for-service model, which rewards volume over value. To sustain team-based care, we need payment structures that incentivize collaboration and outcomes, not just individual visits or procedures. Imagine a system where, instead of paying per appointment, teams are compensated for keeping an entire patient population healthy. That's the kind of shift we're talking about.
Got it. So, changing how we pay for care changes how we deliver it, right?
Exactly, David. And these reforms don't just benefit patients, they also create financial stability for healthcare organizations, allowing them to invest in the teams and resources needed to deliver holistic care. It's a win-win, but it requires political will and advocacy to make those changes happen.
And what about technology? I mean, it feels like tech and data could be game changers here.
You're absolutely right. Technology and data are essential for better coordination. Picture this: a shared electronic health record that connects primary care providers, specialists, social workers, and even community organizations. Everyone has access to the same information, which means care is more seamless, efficient, and patient-centered.
Wait, so no more getting asked for the same information every time you see a new provider?
Exactly. And beyond just records, we're talking about predictive analytics that identify at-risk patients before they end up in the ER, or telehealth platforms that bring care directly into people's homes. Technology isn't just a tool, it's a bridge that connects all the pieces of the system.
And that bridge is what makes scaling this possible?
It's one of the key factors, yes. Scaling this kind of transformation takes more than just good ideas. It requires infrastructure, policy shifts, education reform, and yes, technology, all working together. But the potential is there, and the results we're seeing in places like IPCI's pilot programs are nothing short of transformative.
Wow, it's a lot to take in, but it's exciting, isn't it? Like this whole idea of rethinking healthcare and actually making it work for people.
It is, David, and it's not just possible, it's necessary. If we're serious about building a system that supports both patients and providers, we have to embrace these changes. It won't be easy, but the impact it can have on communities, on health outcomes, on lives, it's worth it.
On that note, I think we've given our listeners a lot to think about. Sophia, thank you for guiding us through this. It's been fascinating.
Thanks, David. It's always a pleasure to dive into these conversations, and I hope our listeners feel empowered to think about what's possible in healthcare transformation.
All right, folks, that wraps up today's episode. Until next time.
Take care, everyone.